Hi, I'm sorry I couldn't be there with you in person, but this message is so important and I really wanted to share, so thank you for listening. Talking to healthcare providers about disparity is not easy. For someone who's dedicated a life to caring for others, the very suggestion that a patient may be treated differently based on skin color or origin is frankly as insulting as it is absurd. Yet we can't deny our findings. Disparities do exist. We found that African American patients were hospitalized for chronic disease at a much younger age than whites. For heart failure, it's 15 years younger. More troubling is age of death, and after looking at a variety of diseases, we found pretty consistently about a 10-year gap in age of death, with blacks dying younger. 10 years. What does that really mean? I can tell you what it means to me. Our family received a very difficult prognosis after my husband's prostate cancer surgery. All of the surgical margins were positive, and cancer was found in the seminal vesicles and pelvic floor. No doctor would agree to follow up radiation therapy with that evidence of spread. I was totally devastated, we all were. The doctor said, if you're lucky, we maybe can get 10 more years. Well, I'm happy to report it will be 10 years in March, and Jake is still enjoying wonderful health. Over these past 10 years, we've celebrated our 40th wedding anniversary. We've watched our 4 daughters mature into lovely, strong young women. We've welcomed 5 grandchildren into the world. Jake's been able to retire, and together we've been able to achieve most of our life goals. I asked Jake what the most special thing to him has been about these 10 years, and he said it was being able to know the grandchildren and be part of their lives. Many think healthcare disparity is a direct result of poverty or lack of education. But let me tell you about my friend Maisel. Maisel's husband Clay was an accountant, and he fit the profile we found in many of the patients we studied. He took a daily pill for hypertension, but beyond that knew of no significant cardiac disease. Clay cut the grass one Saturday afternoon, then sat in his recliner to enjoy a glass of iced tea before dinner. That's where Maisel found him. Clay wasn't there to attend their daughter Ashley's college graduation or support her decision to become an occupational therapist. He wasn't there to stand by Maisel with pride as their son Stephen graduated with honors from Vanderbilt and received a full scholarship to Columbia University School of Medicine. Clay won't know his grandchildren, and they won't know him. Maisel describes Clay as the perfect man, and oh, what she would give for 10 more years with him. The truth is, we don't know why disparities exist. Sure, delivering evidence-based care at every opportunity is a great way to ensure equity. Yet, as Dr. Brent James tells us, only about 20% of medical care is even backed by published evidence. We thought possibly for our cardiac patients, whites had the benefit of cardiologist oversight more often than blacks, but we disproved that theory. We do know that our black patients are less likely to receive cardiac imaging studies, and when they do, disease is generally found at a more advanced, less treatable stage. We also know that for certain inflammatory processes like lupus or sepsis, the disease is actually different in blacks. It's much more severe with more life-threatening organ involvement. And we know that if my husband Jake happened to be black instead of white, odds would not be in favor of him enjoying the outcome that he has. I was born and raised in Memphis during the civil rights movement and remember the marches for equality. Thus, it was an especially humbling privilege for me to be able to share this work at the National Civil Rights Museum in honor of Dr. Martin Luther King Day. Dr. King once called healthcare inequalities shocking and inhumane. It is shocking, but it's also very real. And I want you to know that our commitment to ensuring equity is also real. As you approach the Civil Rights Museum, there's a large granite plaque near the entrance in honor of Dr. King. It's engraved with a verse from Genesis that helps me really understand the very important role that each of us as healthcare providers have before us. And the verse reads, "They said one to another, 'Behold, here cometh that dreamer. Let us slay him, and then see what shall become of his dreams.'"